Eisenhower's fully accredited chest pain center provides fast, state-of-the-art treatment to prevent heart attacks. A highly skilled team with advanced knowledge in the management of heart attacks provides rapid therapy to all chest pain patients.
The general issues that we see are chest pain. It's the number one diagnosis, cardiac diagnosis we have, a chief complaint. We also see irregular heartbeats or arrhythmias. We see congestive heart failure. We see a wide range of types of coronary disease. There's classic chest pain symptoms. There's an elephant standing on my chest. I'm having chest pressure. I'm having pressure when I do exercise. And then there are the subtler ones, particularly in women. Women may have symptoms of nausea or a kind of a vague discomfort or even arm pain or jaw pain. Those things we take very seriously in the emergency department as warning signs for possible coronary disease. For chest pain, it's very clear. Whenever you have chest pain that's unusual for you or something atypical, you didn't just get hit in the chest or you were lifting weights and you're sore, but say you actually have chest pain that's not really explained, not comfortable for you, or even sometimes indigestion that seems out of the ordinary, those are warning signs, especially if you have risk factors. So if you're a person that has not had a stress test, or maybe you have a known family history of cardiac disease, or your lifestyle isn't the best, you smoke, you have diabetes, all sorts of things that would lean you to maybe being at risk for heart disease, those are reasons to get right to the emergency department.
Most heart attacks can be minimized or stopped by seeking immediate medical attention. The key is to recognize what your body is telling you.
Our goal is to have everybody who has symptoms of chest pain to be evaluated, because if we wait and there is actual lack of blood flow to the heart muscle, which is why you have chest pain with cardiac disease, you can cause damage to the heart muscle, and that's what we would call a heart attack or an acute myocardial infarction. The chest pain is a warning sign. It's a precursor of potential injury to the heart muscle. Persistent chest pain or severe crushing chest pain, sweating, sudden onset, that may be a sign of an acute heart attack, but there's more to it than just the acute heart attack, which of course is essential you get to the emergency department right away. That should be a 911 call, and because treatment can start in the field and we can activate things like our cath lab for percutaneous intervention heart attacks, which is what we're designated.
Recently, Eisenhower Medical Center earned the highest designation of Chest Pain Center Accreditation from the Society of Chest Pain Centers, making it the first hospital in California to be Cycle 3 accredited with PCI, or percutaneous coronary intervention.
We're a chest pain center. We have the specialty of being able to have 24-hour intervention where we put a catheter into the groin. The cardiologist, the interventional cardiologist, will put a catheter in the groin and go up and open up a closed blood vessel and put in a stent to keep it open. We have cardiac surgeons that, if it's widespread disease, can go in and do emergent bypass surgery. So we have the full capability. And part of that is that we as an emergency department are anticipating these things. So we work with the ambulance people and the fire, and they call us, let us know. They do EKGs in the field and say, we may have a heart attack here. We activate the cath lab. We will start therapy in the field. The medics may give nitroglycerin. They put in an IV. They start basically caring for the patient right away. When they arrive, we have a team waiting, and we call it a code 8 because we want any patient that comes in with chest pain has 8 minutes from the time they come in to getting their EKG and read by a physician. So we make that our goal. So if you come into our lobby and you have chest pain, we have a goal of 8 minutes to get a EKG. If you come in by ambulance, it's the same goal. That starts the ball rolling to see if you're having an acute heart attack. Now, you may not be having an acute heart attack. You may be having some ischemia or a lack of blood flow to the heart, which gives you pain. When that happens, we start evaluating you and maybe doing other interventions to see, other tests to see if there's a potential for a heart attack. And that would be an indication to maybe do a stress test or something else, say you don't have any injury to the heart muscle, but it's a very good story or a very suspicious story, we'll get our cardiologist involved at the hospital. And potentially at that point, if there's any worrisome findings, we would go ahead and do an intervention to prevent the big heart attacks. One of the things we want to stress, though, is as an emergency department, is we don't even want to see you there. We want you to be getting regular checkups with your physicians. We want you to have your cholesterol checked. We want you to have lifestyle adjustments. And there are drugs, statins, that can prevent cholesterol buildup in the walls of the blood vessels, which, if we start early enough and people are aware of it, they can prevent the big episode when they come to the emergency department. We get people all sorts of ways. We have helicopters that come from the mountain home or Hemet. Sometimes they fly down, or from Desert Center. People having acute symptoms of a heart attack, they'll fly them to us, or acute strokes. We have people that call 911 who are aware of it, which is a very efficient way when you're having chest pain to be taken care of properly. The emergency department folks always think of the bad things first. And if it's indigestion, great. Take some Tums and see your gastroenterologist or your primary care physician, and hopefully that'll take care of itself and stop eating the jalapenos. But there's, we make sure the bad things aren't happening, and we're more than happy to tell a patient, guess what, it was good that you came in, we checked you out, everything seems okay at this point, we're going to get you some follow-up. We're more than happy to do that, rather than having somebody have a heart attack at home because they wanted to, quote, write it out. I see us doing a great job with cardiac care. If I had a heart attack, this was a hospital I'd like to be
in. Next, get well, be well, stay well. Eisenhower's Ranker Wellness Center offers important tips for developing heart-healthy habits.